basic to most activity in work, play, and ordinary existence is movement of the structures of the body. This movement is accomplished through the joints. The junctions are attachments of two or more bones or cartilages. The varieties of joints throughout the body may be divided into three major types: fibrous, cartilaginous, and synovial joints. Each has specific characteristics and subtypes. A fibrous joint consists of two or more bones united by fibrous tissue. Two subtypes are found: the syndesmosis, where connective tissue of the joint is a ligament or ligaments, as in the corticoclavicular articulation, and the suture, such as the union of the large flat bones of the skull. Here the bones are connected by several fibrous layers. The second group of joints, the cartilaginous, consists of three main types: hyaline cartilage joints, involving the union of two bones by hyaline cartilage, and exemplified by the joint between the epiphysis and diaphysis in a long bone. These are modified in later life by replacement of hyaline cartilage by bone as growth ceases. The second type, fibrocartilaginous joints, in which the skeletal elements are united by fibrocartilage during some phase of their existence. Fibrocartilaginous joints include the pubic symphysis and the joints between the successive vertebral bodies. Finally, the synovial joints, which are the most numerous. They are structurally complex and freely movable. All synovial articulations share basic structural characteristics. The contact surfaces of the bones are covered by a thin hyaline cartilage. An articular cavity between the bones is surrounded by a capsule of fibrous tissue. This capsule, in its simplest form, is an envelope of fibrous tissue lined with synovial membrane. The membrane has a secreting epithelium which provides the joint fluid for lubrication. The capsule is reinforced externally, and in some joints internally, by supporting ligaments. These may be free or fused completely with the capsule. In some synovial joints, an articular disc or meniscus of fibrocartilage divides the joint cavity. The synovial joints are classified by the form of the contact surfaces and the types of movement. There are 7 types of synovial joints. In a plane joint, the two surfaces are flat, or nearly so, and slide or glide over one another in any direction, as exemplified by the acromioclavicular joint. A ball and socket joint presents a spheroid surface articulating in a saucer-shaped socket, as seen in the scapulohumeral joint. An ellipsoidal joint is one in which an ovoid convexity fits into an ovoid concavity. An example of an ellipsoidal joint is the radiocarpal joint. A closely related type is the condylar joint, in which two processes of one bone fit into depressions in another bone. The knee is a condylar joint. A hinge joint is a cylindrical convexity fitting into a corresponding concavity. This permits action in only one plane, as in the humeral-ulnar articulation. A saddle joint, exemplified by the carpo-metacarpal joint of the thumb, has a concavo-convex surface fitting into a convexo-concave surface of the opposing bone. This allows biaxial motion. In a pivot joint, a cylindrical head of bone is held within a ring of bone or bone and ligament. Movement is limited to rotation about the long axis of the cylindrical portion. The proximal radio-ulnar articulation is a typical pivot joint. These, then, are the 3 basic kinds of joints in the human body and their specific subtypes. We will begin with the temporomandibular articulation and go from there to the upper and then to the lower limb. The temporomandibular articulation is an ellipsoidal joint with mixed gliding, rolling, and rotary movements. The hinge movement of the jaw is accompanied by a gliding motion in opening or closing the mouth. This allows tearing and cutting action. The second movement is a transverse gliding action in an anterior-posterior direction. Here the mandible is thrust forward and drawn back again. The third movement is an oblique rotary movement of grinding and chewing actions. Movement of the shoulder involves the clavicle and scapula as well as the humerus. The acromioclavicular joint permits elevation of the upper limb above the horizontal. This is a simple joint permitting gliding and rotation. The glenohumeral or shoulder joint is one of the most symmetrical and movable of all joints. A large spherical humeral head moves in a shallow concave glenoid cavity. It is a ball and socket joint with mixed gliding, rolling, and rotary movements. The head of the humerus and its loose capsule are retained in position mainly by muscles and less so by ligaments. In flexion and extension, the head of the humerus moves upon the center of the glenoid cavity. Flexion has greater motion than extension. In abduction and adduction, the scapula is fixed, and the head of the humerus rolls and glides within the glenoid cavity. In circumduction, the head describes a cone with its apex at the glenoid. In rotation, the head of the humerus turns medially or laterally in the glenoid in a gliding motion. The next joint, the elbow, is a hinge joint with mixed gliding and rolling movements. There are two articulations, the humeral-ulnar and the humeral-radial. The bones involved are the distal end of the humerus and the proximal portions of the radius and ulna. Flexion and extension are limited respectively by the coronoid process and the olecranon process in their corresponding foci of the humerus. In flexion and extension, the depression of the disc-like head of the radius glides upon the capitellum. The medial margin of the head of the radius moves in a groove between the capitellum and the trochlea. At the elbow is also the proximal radial-ulnar joint. Here the head of the radius fits into the radial notch of the ulna to form a pivot joint. The articulations of the forearm and hand are divided into two groups, a proximal or radiocarpal joint and the intercarpal articulations. The radiocarpal or wrist joint is ellipsoidal with mixed rolling and gliding movements. The distal end of the radius and its articular cartilage provide a smooth concave surface for articulation with the carpal bones. Radiocarpal joint movements are free. The multiple articulations allow all angular movements, including circumduction. Abduction and adduction are restricted by the bony radial and ulnar styloid processes and the strong ligamentous bindings. The intercarpal articulations also are involved in movements of the hand. There are three articulations: articulations of the proximal row of carpal bones, articulations of the distal row of carpal bones, and midcarpal articulations of the two rows with each other. The first two are ellipsoidal joints. Their bones are connected by palmar, dorsal, and interosseous ligaments. The joint between the scaphoid, lunate, triquetrum, and the distal row of carpal bones is the midcarpal joint. It is bound by palmar, dorsal, radial-collateral, and ulnar collateral ligaments. The intercarpal articulations are surrounded by a capsule with an extensive and irregular synovial membrane extending to the carpo-metacarpal joints. The carpo-metacarpal joint of the thumb is a saddle joint combining mixed gliding, rolling, and rotary movements. The bones are the first metacarpal and the trapezium. They have reciprocal saddle shapes. Movements are controlled by the shape of the articular surfaces. In flexion and extension, the first metacarpal moves back and forth on a transverse axis on the trapezium. In adduction and abduction, it slides from side to side on the anterior-posterior axis of the trapezium. The metacarpal phalangeal joints are ellipsoidal articulations formed by the rounded heads of the metacarpal bones in the shallow cavities of the proximal phalanges. Each is bound by a palmar and 2 collateral ligaments. The interphalangeal joints are hinged with mixed gliding and rolling movements. They have an articular capsule, collateral ligaments, and an accessory palmar ligament. Movement in these joints is limited to flexion and extension on a single transverse axis. In considering the lower limb, we can start with the hip and then proceed to the knee, ankle, and joints of the foot. The hip is a ball and socket joint formed by the head of the femur in the cup-shaped cavity of the acetabulum. The articular capsule of the hip is strong and dense and is more extensive and stronger anteriorly and superiorly than posteriorly and inferiorly. The capsule itself contains the iliofemoral, ischiofemoral, and pubofemoral ligaments. Movements at the hip joint correspond to the freely movable shoulder joint. There is limitation because of the more complete socket. This is a triaxial joint capable of a variety of movements: flexion, extension, abduction, adduction, circumduction, and rotation. Any non-antagonistic movements can be combined. The knee is a modified and complicated condylar joint, combining mixed gliding, rolling, and rotary movements. It is the largest and one of the most superficial joints of the body. And because of the incongruity of its bony surfaces, it is one of the weakest. Its strength lies in the ligaments and its powerful muscles. 2 articulations are present: the patellofemoral and the tibiofemoral. The patella is an irregularly shaped sesamoid bone contained within the tendon of the quadriceps femoris. It lies outside the capsule of the knee. The patellofemoral articulation is between the patella and the condyles of the femur. With the knee extended, the patella is anterior to the condyles of the femur, superior to the axis of the joint. As the knee is flexed, the patella moves into the groove between the condyles of the femur, filling this groove and protecting the condyles. The tibiofemoral articulation is essentially 2 joints, with the 2 convex condyles of the femur articulating with the 2 concave condyles of the tibia. Because the tibial concavity is very shallow, maintaining the knee joint at rest and in motion depends upon the surrounding articular capsule, the ligaments, and muscles. Also helping are 2 wedge-shaped semicircular fibrocartilaginous menisci. They are thicker laterally and posteriorly. Movements at the knee are flexion, extension, and in certain positions, slight medial and lateral rotation. The movements differ from a typical hinge joint in that the axis of motion is not fixed. It shifts forward during extension and backward during flexion. Movement of the ankle and foot in walking is ankle motion, and motion between the tarsals, metatarsals, and phalanges. The ankle is a hinge joint formed by the distal end of the tibia, the malleoli of the tibia and fibula, and the medial and lateral facets of the talus, along with its upper convex surface. The ankle has an articular capsule and synovial membrane. The support of the ankle is from the deltoid, anterior talofibular, posterior talofibular, and calcaneofibular ligaments. Motion is almost entirely confined to flexion and extension by the closely fitting bony structures and the very strong ligaments. The talocalcanonavicular joint resembles a ball and socket joint. The head of the talus fits into a socket formed by the calcaneus and navicular with mixed rotary and gliding motion. The bones are bound by strong ligaments, articular capsules, and synovial membranes. They allow inversion, eversion, abduction, and adduction of the foot. The tarso-metatarsal articulations are between the cuboid, the medial, intermediate, and lateral cuneiforms, and the bases of the 5 metatarsal bones. These are plane joints, and the bones are held together by dorsal, plantar, and interosseous ligaments. Movements are limited to slight gliding of the bones. The metatarsophalangeal articulations are ellipsoidal, formed by the rounded heads of the metatarsal bones in shallow cavities on the proximal ends of the proximal phalanges. These joints also have articular capsules and synovial membranes and are each held together by 2 strong ligaments. Movements at the metatarsophalangeal articulations are flexion, extension, abduction, and adduction, together with some rotary motion. Interphalangeal articulations are hinges. Each has an articular capsule, synovial membrane, and plantar and collateral ligaments functioning similarly to those of the interphalangeal joints. Motions are confined to flexion and extension. Only through careful and intensive study can the student appreciate the complexities and interesting variety of movements of the human body.